Good morning, everyone. We apologize for the technical difficulties. This is our very first virtual summit, so thank you for bearing with us. Hope that you can all hear us. We do have down at the bottom of your screen, we have the Q&A and chat box. If you cannot hear me now, please pop it in the chat box. We've got people logging in now. They're just jumping in like crazy. So we're just going to give it another few seconds and then we will get started. Okay, well, again, good morning, everyone, and welcome to our very first HFMA Colorado Chapter Virtual Fall Summit. I am Pilar Mank, and I'm your Colorado HFMA Chapter President. Again, apologize for the technical difficulties, but the world that we're living in now, you know, if you don't have technical difficulties, something must really be wrong. So thank you again for joining us. I want to take a moment and recognize our annual business partners. Without them, I don't know where we would be as a chapter, as I know most chapters feel the same way. They not only provide financial support for our chapter, but they also share their knowledge and expertise through speakers and presentations. Their support allows us to operate as a chapter and to bring new members quality education, resources, especially through this challenging time. We hope and ask that when you are looking for a service for your organization or for support, you look at these sponsors and these business partners first. And with that, I'd like to take a second here and just tell you who they are. Our platinum sponsors are Athena Health, BC Services, Collection Center Inc., Continuum, Patient Co., PFC, PFS Group, Revenue Enterprises, TransUnion, and WHA. Our gold sponsors are AccuReg, BKD, Clifton Larson Allen, Credit Service Company, Healthcare IP, KeyBank, Plant Moran, and Guidehouse. Our silver sponsors, AppRev, Bessler, pardon me, Brownstein, Hyatt, Farber and Schreck, Colorado Health Facilities Authority, Coronas, Crossroads Health, Cyberscience, Hall Render, Para Healthcare Analytics, Strata Decision Technology, Extend Healthcare, and our 2020 virtual sponsor is Commerce Health. For today's webinar, we will be using a Q&A box that you can see down in the bottom right-hand corner of your screen. For questions, please put it in that Q&A box, and then the panelists will respond to that as well as our moderator today. A link to download the presentations will be provided in the chat, as well as sent to you via email after the webinar. Sorry about that. If you're requesting NASBA CPE certification, please take note that your keyword is, for this session, autumn. You will need to complete a polling question during the webinar. There are a total of 3 polling questions you will be required to answer in order to receive that credit. And again, your word for this session is autumn. And with that, this morning's session is a CFO panel, and it is moderated by Tammy Galindez. Say hi, Tammy. In Tammy's current role, Tammy leads TransUnion's healthcare go-to-market strategy and client-facing functions. A member of HFMA since 2002, she has served the National Association as a member of the National Advisory Council and as an elected director, excuse me, and on the national board. She is the recipient of the HFMA's Medal of Honor, as well as the Fulmer Bronze, Reeves Silver, and Munson Gold Merit Awards. In in June of 2021, Tammy will be installed as the 2021-2022 National HFMA Board of Directors, Chair of National HFMA Board of Directors. She is the CHFP and a fellow of the HFMA. Sorry about that, excuse me. And with that, I am going to turn it over to Tammy, and again, want to thank everyone. And one last time, what's your word? Autumn.
Okay, great. Thank you, Pilar. I assume everyone can hear me okay. If you can give me a thumbs up there. Okay, perfect. So I want to thank you first to the chapter for the invitation. Obviously this year as chair-elect, we're usually kind of heavy on the road, and so it's good to be able to have at least this forum to be able to connect with our membership. And over the last several months, I've become just incredibly encouraged by how valuable HFMA has been to its membership. So you all have assembled an impressive program here, and I applaud you on that. So we're all innovating in how we do everything these days. I also want to thank the panelists. You know, we're all very busy these days, and these folks certainly are that. They have impressive bios. I encourage you to read the bios that was on the meeting material that was provided online. I'll take a few minutes to introduce them to you here today before I open it up for questions. So I will start with Rick Schrader. So he is the CFO at Southwest Health Systems, which is operating Southwest Memorial in Cortez. He has over 28 years of experience in healthcare finance, revenue cycle, and operations. In his career, he's primarily worked as a CFO or a revenue cycle senior leader, but he has also owned his own healthcare consulting company. And he's also worked for a real estate investment trust and has worked both for proprietary as well as nonprofit organizations. So he brings a wide breadth of knowledge and experience, and we welcome him. Yeah, Bill Munson. Good morning. Thank you, Rick. Bill Munson is CFO at Boulder Community Hospital, and he's been there since 2008. He has more than 30 years experience in hospital finance management. Prior to Boulder, Bill was CFO at North Colorado Medical Center in Greeley, and he has also had leadership positions at Humana, so he brings that payer experience. He's worked as an adjunct professor. He serves on several boards, delivering important community services to the folks that we care so much about. And currently, more recently, he has been appointed by the Colorado Senate President Grantham as the hospital representative for the Medicaid Provider Rate Review Advisory Committee. So we welcome him and his rich breadth of experience. And then finally, Yvonne Whittington. She is the CFO with more than 26 years of experience. Currently, she's at Montrose Memorial in Montrose, and that is a strong, independent, and award-winning hospital. So she brings a rich set of skills from having pulled that off. Yvonne is originally from Wyoming. She went to school in Nebraska, and then she came back to Wyoming actually was there for 26 years. And it was during that time that she was senior vice president and CFO of a 2-hospital system with 249 beds and more than 600 million in gross patient revenue. So again, a rich set of skills and experience. Collectively, you have more than 75 years of experience here. So I encourage you to listen to their pearls of wisdom today and to make notes, and then hopefully we can have some good time to answer your questions at the end. Today, I plan to break up our time today in about 5 different chunks, if you will. They're all somewhat related. We'll talk about challenges that are facing the healthcare organizations, impact on reimbursement reductions, and then finally, where everybody's going in this next 2021. So with that, let's get started, and I'm gonna start with COVID, as likely as no surprise to any of you. To set some groundwork here, I'm just going to provide just a couple of overarching data that I think will help kind of ground us in the conversation. Just this morning, TransUnion Healthcare distributed new consumer research focused on how the patient financial experience has changed over the last year, and particularly how COVID-19 is shifting how patients are seeking medical care and thinking about their healthcare cost. Some of the key findings include 59% of patients have decided whether or not to seek care and have deferred non-COVID related medical care in the last 6 months. and 49% of patients indicated that the state of economy has at least some impact on where they seek care. So that obviously is manifesting itself in your hospital admissions. And so earlier this week, just this Monday, Kaiser published an analysis on the magnitude of the drop in the hospital admissions and the volatility thereof. And so some of their key findings was 68, in April, there was 68.6% of predicted admissions were happening, and so huge drop there. In July, it came back up to 94.3% and then back down to 90% in August. So all of that kind of highlights the importance of operational preparedness, financial reserves, and kind of affirms all of this work we've been doing on consumerism over the last many years. So my first question to each one of you, same question. I'm interested in, and as is the constituency here before you, how has your organization been impacted by COVID? And although we continue to learn each day, right, we're in the throes of this right now, what are some of your early lessons learned? And just by way of how the boxes are laid out on my screen here, I'll start with Yvonne since she's on the top left here. So Yvonne.
Good morning, thank you. As I think through this question, the first thing that comes to mind in terms of learnings, as an organization, right away, we learned that we were stronger than we ever knew we were. We learned that we were more creative than we ever thought we were. And we also learned that we could invoke efficiencies in a very short period of time. I think there were times that we amazed ourselves in what we could develop in such a short period of time. For example, standing up telehealth in all of our clinics in 1 week's time, which prior to that took several months for us to do. Given that, we also over time have learned that individually, we're also very fragile. We're strong as a team and can react to the crisis and come up with very creative solutions. But as we see in our communities in the United States, that exhaustion that's taking place and the anxiety, we're finding that we're fragile. So as leaders of our organization, it's a bit of a different dynamic. And not only are we leading our organization through our challenges, but also our employees. There's many external challenges that all of our employees are faced with. So in terms of leadership, we're absolutely taking that into account as well. And the last item that we learned is we've known that our community supports us, but we had no idea to the extent that our community would support us. It was absolutely amazing and heart-moving to see our community rally around us, and they still do it today. That was just by way of women getting together, making masks for us. Personal donations to the hospital was amazing. The story that touches my heart so immensely is the elderly woman who came in and paid the bill for her deceased husband, thanked us for our care, and asked if she could give us a $500 donation at the time she was paying a patient bill. I mean, it's just absolutely remarkable what our community has done for us.
Wow, that's great, Yvonne. Thank you. I love that. And those are the stories I think it's important to kind of make sure we talk about that alongside of all of the struggles. So Bill, you're next in my box here. So
I certainly echo everything that Yvonne said. That all of those were experiences I think that were probably universal to a lot of us, and certainly we experienced that as well. And I would just add an exclamation point, I think, to the impact this has had on each individual employee. You know, if it wasn't from a reduction in hours, you know, it was from having new work assignments, it was from having anxiety about, you know, the risk of the illness, it was, you know, the emotional dealing with taking care of COVID patients. And then on top of that, they all have, many of them have the financial stress at home and other impacts on other family members. And so I think one of the things that's really we're very aware of right now is that our employee population, is feeling a tremendous amount of anxiety and pressure. And then on top of that, we've got the elections coming up. So it's a world that creates a lot of anxiety right now. And I think healthcare workers are right at ground zero as it relates to that. So I just wanted to add an exclamation point. Maybe rather than repeat everything Yvonne said, I'll just sort of state what our experience was, which I think was very similar to the state of Colorado. In early March, when we were told that the wave of COVID admissions was coming, it was predicted that most of us would have, by the end of April, more patients in our hospitals. I would say more than 2 times the number of patients in our hospitals than what any of us had for licensed beds. And so, as Yvonne said, I think we all amazed ourselves at how quickly we pivoted and were able to prepare and respond to that anticipated surge. The reality of what happened was that that surge did not occur. I mean, we certainly saw a rise in admissions across the state, but at least for our organization, the largest number of inpatient COVID patients we had at any one time was about 12. So it was never any more than a very small portion of our capacity. And so, as you already pointed out, Tammy, the impact of shutting down all of our elective procedures and the impact of our communities utilizing less healthcare, has really been a dramatic decrease in our volumes and our revenues. For us in April, our net revenues were about half of what they would normally be, and now we've climbed out of that, and we're probably averaging more at this point along the lines of 5% less than what we would have had in 2019. So we're certainly not out of it yet. We've come a long ways, but financially, the dramatic impact has just been the reduction in volumes.
Great, thank you. I think a lot of hospitals are dealing with, they're anticipating this surge, instructed to kind of hold beds for that. And it really has had a dramatic impact on the elective procedures. Rick, what would you offer about your experience with COVID?
Yeah, I'd echo what Bill and Yvonne said, specifically with the advent of the community coming through for us. We had a lot of partners step up in terms of other industries that made some masks for us. One of the other things is we tried to stay about as nimble as we could, and we implemented a work from home kind of strategy, which I think most of our IT experience is going to say, okay, guys, we're going to do laptops and docking station instead of desktops. But we got fairly nimble with that. We looked at kind of outfitting whenever some of our employees did come back, to putting in some hard plastic barriers or so forth for their safety. We went virtual. Like I said, most of us figured out how to turn our cameras off, and it took a little while to turn our cameras back on, as I had some technical difficulties today, because sometimes you don't, it's better not to be seen, especially if you're working from home and maybe less than professional attire. But again, I'd say the impetus is everybody rallied. The other thing that we kind of thought through and that we asked for, we were going through a employee assessment survey, and one of the biggest things was communication. So we do a virtual all employees on deck meeting at lunch every Wednesday, to where we can kind of address topics. Furloughs were on people's mind. We were blessed that we didn't have to furlough, but going back to Bill and Yvonne's points, we did have to create a couple of new departments, which were the COVID screeners to determine if anybody had any symptoms or fevers or things like that. And then it was kind of restricting some of the access. We did have a lot of our employees stepped up, because when you're admitting people into your hospital and they can't take a loved one or friend with them, it put a lot of stress on the patients. And we did have a lot of our health workers kind of step up in new areas where they hadn't been. To echo the points on volumes, we're a critical access hospital in Southwest Colorado, so I think at most we had 6 patients. August for us was a phenomenal month. It went ahead of 2019 and ahead of budget expectations and so forth. But again, that's a rarity. The other months were down. We started coming back about towards 85–90%. Most of our caregivings were outpatient related, not a lot of inpatient stuff, but we did see a lot of positive interaction between some of the community leaders with the city, the county commissioners, the health department, so forth, to where we kind of aggregated into how we could work with the community, providing them some health checks at their door for businesses, to where they could screen with the touchless thermometers and so forth. So, but probably the paranoia is okay. Is there going to be a COVID-2, and if so, when's it going to happen? And again, looking at the feds, whenever they're going to, how they're going to end up allocating stimulus or taking it back or stuff like that, the forgiveness pieces. So yeah, we were blessed with jumping in the PPP program. So there's a lot of things that were positive that kind of propped us up. Now we're trying to figure out, what do we have, and what's our expected payback on some of the fundings, and that's creating a little bit of stress.
Yeah. Well, thank you. And I think you raised the work from home program. I know TransUnion, we've got more than 8,000 employees, and granted, our business as a business partner is different, right? So we're not delivering critical care to our communities. So we quickly brought everyone in-house, all 8,000 of us. And I would say, as I kind of work my way around the country and talk to different leaders like yourselves, it's varied as to the long-term plans for that model. There's certainly a lot of organizations out there that plan to reduce their office footprint, and if they can maintain productivity and so forth. And then I've talked to others that said, nope, we're going right back to where we were. That works best. So I think we'll see how that all falls out. But the latter part of your question, Rick, actually is a good dovetail into our next question, which is really about more of the blocking and tackling, right? So no one anticipated this drop in admissions and or revenues. And so, some organizations' ability to weather that storm looks a little bit different than another facility's ability to do so. So a recent study from JAMA found that the median hospital had enough cash to pay for its operating expenses for 53 days back in 2018. So it's dated. In that same year, however, and those hospitals in the 25th percentile, they only had enough days, they only had 8 days cash on hand to pay for operating expenses. And so, again, everyone's propensity to be able to manage this is different. Smaller hospitals and rural hospitals are among those more likely to face financial challenges. And of course, you all work for independent organizations. And so my question, I'll pose maybe a little bit different question to each of you. Again, I'll start with Yvonne. So can you share with us how your organization is responding to a landscape where the sand's constantly shifting? And I think more specifically, I am interested in how you all are managing budgeting and planning in the midst of those dynamics. So how frequently are you adjusting your numbers? Have you been able to hit those? If you'd share a little bit about that, I think that'd be great.
Absolutely, I'm happy to. At the onset of COVID, our CEO did something I think was really brilliant. He really divided our senior leadership team and asked the more clinical senior leaders to focus on the crisis at hand. And then he took the other senior leaders and said, we need to focus on strategy and sustainability. And I think that was brilliant, in that managing a crisis and long-term planning take two completely different skill sets, And to try to combine those and work on those at the same time is really challenging. And so from that, we were able to develop what we call our sustainability teams. From that, we were able to do our long-term planning. And I think that was really important. We identified right away that we could capitalize on the sense of urgency. So everybody did have this very unusual sense of urgency and attentiveness to the current financial situation. From that, we really utilized our employees as teams to come up with the brilliant ideas that they develop every day in what they're doing, working on the front lines, to develop a cost reduction team. That team has led our organization to many, many different cost reductions. We also knew that, again, capitalizing on that sense of urgency, that revenue cycle, there's always improvements that could be made in revenue cycle. We have one of our employees in our organization who developed an Every Dollar Counts campaign, and that's where that provided the platform for our organization to go out and ensure revenue integrity and accelerate our revenue capture through documentation, all focused on our COVID recovery goal. With that, we then started doing, as you alluded to, Tammy, how do we prepare ourselves? What are we doing with our forecasting? We started forecasting. We developed with a vendor partner a model, a COVID impact model, and we were able to feed our data into that. We also stayed in close contact with the epidemiology data to help us try to predict what would that caseload look like? What would our patient volumes look like? So what we did is we developed a methodology of the COVID dip, and that is what we experienced during that March, April, May, and part of June as significant losses in our financial performance. And then we saw our business turn. And that's when maybe we were experiencing some pent-up demand after we reinstituted our elective procedures. And that's really the phase that we're in right now. And we believe that the next phase is we determine what is that recapture, where we start recapturing some of that business. And then what is the new normal? At Montrose Memorial Hospital, we believe that healthcare is going to be very, very different when we say we're settling into our new norm. We think that the delivery of healthcare will be very different, as will our volumes. So at that point, we started forecasting. We are a calendar year end. And so in June and July, we started forecasting for the next half of our year. In that, we reestablished our volumes, tried to address what is that new norm. But again, we use the epidemiology information as well, what we're seeing going on around the state, to try to predict those volumes. That served us very well to really reinstitute a new forecast. That kind of level set everything, even down at the department level, department director level. Here's a new norm that we now have to operate each of our individual departments from. In the midst of all of that, we also made a decision to suspend our implementation of Epic. We had started implementing Epic in January. We decided that we needed all employee resources to tend to our COVID crisis, and that would just be too much for all of our employees to try to implement a system in the midst of COVID. So part of our forecasting is, okay, now when will we start that implementation again? So that was a big predictor of our financial outcomes for the rest of this fiscal year. I'm very happy to report that we do feel like we are in that turn phase of the COVID impact, and that we are rebounding. from the financial distress. We are seeing our volumes increase, but interestingly enough, it appears that our surgeries have leveled off, but it's really our acute care, our non-COVID related acute care, that we're really seeing spikes in those volumes over the last couple of months. So again, that's a new normal that we're adjusting to. We have actually, just for our acute care, have had to go on divert in our ICU, and again, non-COVID related patients. So back to your point earlier, Tammy, that may be due to some delayed care, but we're seeing that healthcare pattern in our consumers and our patients change a bit. And so we are adapting. We're adapting now to determine, is this going to be a consistent trend with higher acuity patients and higher acuity level care that we need to plan for in the future?
Wow, very, very interesting. And just throw an Epic implementation in the middle of all of this.
Yeah.
That's the gift that just keeps on giving there. So thank you, Yvonne. That was awesome. Bill, I want to ask you the same question, really centered around just financial preparedness and planning and so forth, but I'll ask the question a little bit differently. Boulder recently announced that they had partnered with Optum to support their entire revenue cycle operation. And so I'm curious, again, similar to an Epic implementation, that obviously is a decision you had been contemplating for some time prior to COVID. So, how has all of this changed? What are your goals that you expect to get out of that? Has that changed in the midst of COVID? Really interested about how you're navigating that.
Sure, and revenue cycle is a really important, foundation of our relationship with Optum. But just so I guess for some context for the audience, it is a broader, more comprehensive relationship that we began discussing about a year ago, and it only became effective on September 28th. So we're not even yet a month into the relationship, but it supports our continued focus on high quality, convenient, affordable healthcare. And it flows from our vision statement, which is to partner to create the healthiest community in the nation. And I emphasize the word partner. An organization of our size, which is smaller clearly than the large systems, really requires partnering smartly and strategically, to make sure we can perform at or above the level of our competitors. And what made this an effective partnership is that both organizations share a strong belief in the value of an independent, community-based, locally governed health system. So that made the ideal partnership. But the partnership includes rev cycle. It includes care coordination, both on the ambulatory and inpatient side, and it includes supporting all of our analytics. And we rebadged about 250 or 60 employees that now are Optum employees, but they remain located and dedicated to serving our organization. The reason, and as it relates specifically to revenue cycle, it covers everything from front end to back end. So everything from the pre-registration services, the scheduling and insurance verification and so forth, all the way to the back end, through coding and documentation improvement, all the way to the back end, which is the collection of the bill. We've always had an incredibly dedicated and talented group of people working revenue cycle that performed way above their weight class. But by bringing in the partnership with Optum, I mean, really what we do for that team is we provide them the best tools, immensely more resources, subject matter expertise, deep and sophisticated analytics to really support the job they're doing and help them to perform at a much higher level than we would be capable of ever achieving, based on the level of scale and support that our organization can provide to them. So the clear objective in the partnership is that, we'll get a greater yield out of our revenue cycle, meaning, we will have the ability to reduce denials, reduce bad debt, accelerate cash flow, and be more efficient and effective in the process of yielding that revenue cycle. So that's the and I think everybody hit on the point already. You know, we none of us in healthcare can leave a penny on the table anymore. You know, our reimbursement rates go up at a slower rate than our expenses do typically, and so revenue cycle, it becomes an absolutely essential that we're getting every penny out of that that's possible. So that's the genesis of the relationship.
Perfect. Thank you. Very interesting. We'll be anxious. I'm sure you'll be asked back at one of these meetings to talk about how that's all going, especially a month in. Rick, I want to ask you, maybe pull it up a little bit and ask you a similar question about financial preparedness, but maybe broaden it a little bit around the rural hospital infrastructure. And I think there's, pretty widespread concern across the state because you have a vast amount of rural communities, as does Texas, where I'm located. What is your hospital doing in terms of being prepared for the possibilities that come? How are you kind of informing the position, that you're taking? What are some of the resources you're using to inform that direction?
Yeah, well, one of the things we did with COVID is we had planned an RTU. We had to replace it over our surgery unit, so we closed that thing down. And I think one of the things we've learned with COVID is you can't have as much air intake, exchanges and so forth. So we did that in September, and we're trying to make our hospital about as COVID prepped as you can be. Some of the things that we did is, we partnered up. We looked for some PPP, and then we had not had PAPRs before, PAPR suits and filters. So we bought about 30 PAPRs to kind of prep everything. We also had an opportunity to take a look at, again, some of our revenue cycle approaches to go ahead and you kind of re-examine some of the pieces and processes that we have from insurance verification, working with partnership. We're in our budget season. We're calendar year, and looked at maybe some of the opportunities for any type of grants and funds. And our foundation stepped up and helped us in a couple of things. We looked at getting a BD Max machine where we can turn tests around fairly quickly and be partnering with the community. We looked at where we can again make intelligent decisions. Get leaner from that standpoint. And what other needs do we have? We did not have a great telehealth program with a lot of our providers, and we have about 30 plus practitioners that work on site here and that are instrumental employees within our organization. So we had to kind of respond and quickly learn how to do things with respect to telehealth, seeing the patients. And Yvonne made a couple of excellent points earlier. With a lot of people that didn't really know what COVID was, and it's a very serious, can be a serious and potentially fatal illness to some people. I think some care was delayed. Was delayed. I think the media and other people call them elective procedures, but nobody elects to go in and have a colonoscopy, for instance, or elects to go have certain other testing. So we wanted to be on the forefront and saying, okay, we ended up trying to keep everybody as safe as possible. We bought a UV cleaning unit to where if potentially impacted rooms in our ED bays and our surgical suites and our physician practices, that we can go in there and hit it with some UV light and then clean it on the back end, just to kind of ensure safety. And from looking and tying to the financial impacts and how we're looking for this, yeah, I mean, we're trying to figure out. I don't know if you want to call it a new normal, but because I don't know if we're kind of through this enough to figure out what normal is. And most of you guys that know me know that I have a different sense of normal than a lot of people. But you've got to take a look at where potentially where we're going and what we can do for our employee safety. Again, our pandemic, from our how we managed it, we were graded when we did our employee survey, and a lot of people said that they had some confidence in the senior team here, which was invigorating to us because we knew we were able to communicate. And like Yvonne said, people stepped up and made some recommendations about how we can better protect our resources and how we can extend extend those dollars. And Bill made a great point about how you've got to go ahead and protect our dollars. We did see a lot of cooperation with some of the payers that kind of did a rush to, or maybe not a rush, but basically saying, okay, telehealth is approved for these various things. We saw CMS step up and add some additional codes for COVID or telehealth and approved type procedures. So we were taking that under consideration. It also gave us some time to kind of look and catch up in our revenue cycle processes and make sure we're prepared, and to make sure that we are a going concern, and just to try to determine to make the best use of the dollars for our community and so forth. So that was instrumental with our leadership team. And were a lot of us nervous when it first hit in March? Absolutely. And you kind of progress and you kind of build upon roadblocks, and it kind of brings you closer. You have two options. You can either grow closer as an organization, or everybody can kind of spin a little bit out of control. So we were able to kind of pull together. We also learned some of the great employees here, some of their leadership capabilities that may have been a little unknown, and we feel like that strengthened our team as well and prepared us for the future. To continue being a going concern and to provide healthcare in our county and our market.
Fantastic. And you mentioned several things there. I think we could go down several paths pull different things from what you just mentioned. Lots of conversation we could have as a result of that response, Rick. So thank you. And I think I'll take one piece of that when you talk about how you are collaborating with the payers in terms of the reimbursement. I'll kind of bleed that into my next question here as we kind of get to reimbursement. And Bill, I think I'm going to start with you on this one. So if you take what Rick shared and think about, how the information is coming at us so sporadically and inconsistently from CMS and other payers, like Rick referred. There's been a fair amount of money that's been out there for hospitals to receive grants, particularly the one, the $175 billion from HHS. Mm-hmm. So can you share what you've been doing to ensure that not only are you getting that information and digesting it and then operationalizing it, so what are you doing to make sure you can take advantage of the funds that's out there?
Yeah, happy to do that. And for the three of us on the panel, none of us have really deep benches of people that can, focus on monitoring all these things. So I think the result is it's required me and probably everyone here to be, really hyper focused and religious on just monitoring daily communications that are coming at us from all sorts of different directions. I mean, certainly I'm religiously following, any communications I get from HHS and CMS, and I'm watching, the Hospital Association and HFMA news alerts and the Colorado Hospital Association. I'm relying on, vendors, vendor emails that summarize what's going on and keep me alerted. We certainly lean on our vendor partners to help us interpret some of them. So, examples would be, leaning on our auditor in order to help us interpret, how we measure revenue loss as it relates to requesting stimulus. For our organization, and I imagine everybody else are in the position where I think we're all, out of necessity, we want to make sure we avail ourselves of all potential sources of support and assistance financially, through the pandemic. And honestly, I think it's been manageable, but it's been something that could not be neglected during this time. I mean, it really has taken a hyper focus just to make sure we don't miss anything. So, I think it's for us, that's been, immediately applying for and receiving the Medicare advance payments. It's been applying for every round of stimulus. It's been applying for any and every grant that we were eligible for. It's been, we've already applied for and received approval for our FEMA assistance. It's, getting our business disruption insurance filed and paid, and it's watching for any and every grant, and then it's also reaching out to our community for support as well. So I think we're just trying to make sure we cover the entire every opportunity.
Rick, would you have anything to add to that? How is your organization making changes to make sure you're able to take advantage of some of the grant money that's out there?
Yeah, we have a hospital district, and we were able to participate with some DOLA grants, and then and looking at a couple of other opportunities. That's where we were able to purchase the UV cleaning machine. Just one of the things is you get inundated with a lot of emails, a lot of good information, and like Bill said, we've kind of leaned on our auditor and they audit in a lot of different states. So it's good to have another perspective, just outside of Colorado. One of the things that we're trying to take a look at and determine is, okay, I'd tell you about the only thing that's clear right now is the Medicare advance funding, that payback process. There have been a few things about the stimulus monies. There have been a few things about PPP for those of us who were eligible and able to go ahead and do it. And when you kind of look at things, you're preparing multiple financial models going, okay, is it based off a net revenue standpoint? Is it based off an operating loss for stimulus? Are you able to, make some improvements to your facility and utilize stimulus money for that? Dealing with potentially air exchanges or taking something that's 1970s carpet and then making it some kind of laminate flooring or tile flooring. A lot of the conference calls, and I would encourage you guys to do this if you don't. I know Yvonne and I were part of the Western Health Alliance, so we get on the WHA calls, and there's a lot of input from CHA, as well as looking at the CHA memorandums. And Tom Rennell and his team do a great job at kind of keeping us up to speed. And right now, I think it's probably a wait and see. We have a significant amount of reserve that we have, and we have not booked everything to our income statement. It's trying to go ahead and balance and manage those particular atmospheres, as well as saying, okay, if HHS or somebody says, you need to take this back, we're going to take this money back, then, how do we operate without it and maintain, the solvency of the organization? Plus, I would say I can't speak for Yvonne or Bill, but hopefully you guys have had about as much fun as I have implementing the Medicare advance funding payback over the next 29 months starting in April of 2021. So we were kind of looking at that, looking at projected, and then do we stay with our 2020 numbers, or do we kind of adjust them back to 2019 and things like that to figure out at what point those paybacks will occur, either in full or in part. So that it's always been kind of interesting in doing some modeling. So if anybody has any ideas out there, hey, we're all happy to learn and share.
Yeah, thank you. And I think that what you've just articulated is kind of testament to the value of the community that HFMA provides, the ability to just confer with your peers and to and you know, folks that have a shared challenge. So I shout out for that call out to say, you know, hey, if you've got something, I'd love to hear it.
Sure.
I'm going to shift gears a little bit here, and I want to talk about leadership. And each one of you have introduced the concept of leadership in many of your responses, whether it's, you know, people have presented themselves as leaders that you might not have earlier identified, or something even much more intentional. And I think, you know, while variations of discord, right? So I want to talk about kind of the society at large right now, and what you all as leaders in your communities and in your organizations, what roles do you all play in that? And while I fully recognize that there's variations of discord within your communities and organizations, there's no denying that there's an incredible amount of unrest, right? About inequities that's prevalent in our society at large. And so, you know, I've just finished this book by Isabel Wilkerson called Caste, C-A-S-T-E. And there was a quote in there that resonated with me, and it said, diversity without power cannot bring about change. And power within that context that she was speaking about, it was about the proverbial seat at the table, right? So you can have a diverse, you know, community or a diverse, you know, organization, but unless you bring those voices to the table that make decisions, you're not really going to be able to impact change. So Yvonne, I'm going to start with you on this one. It's well documented that women occupy a disproportionate amount of the C-suite seats within healthcare. What role do you think you can play, or other women should be playing, in helping to ensure that women have a seat at this proverbial table?
Thank you for the question. Happy to answer that. I think that foundationally, we all, women, men, we all have a professional responsibility to ensure that our skills are progressive and up to date, and that we are learning, just like Bill and Rick stated in regard to the CARES funding, how diligent we have to be to learn as much as we can. And I think that HFMA provides a perfect platform for that. We have every opportunity to learn through HFMA, but we also have that ability to enhance our professional growth through our achievements with HFMA.
24 hours.
Additionally, I think that really that seat at the table is dependent on credibility, how we establish credibility with our team,
Morning.
with our coworkers, and value the voice that everybody brings.
Yvonne, let me just pause. Excuse me, if you're, I don't know if there's, could you please put yourself on mute? I'm not sure which mic that's coming from. I don't know how to work the Zoom platform that well. So thank you. Okay, Yvonne, we're ready.
Great, thank you. What I was saying is building credibility and establishing relationships is very important. I think that particularly now during COVID, there's different voices that need to be heard that maybe we haven't heard in the past. And I really think as leaders, the only way that we'll hear those voices is if we value every voice that comes forward and provide that opportunity for voices to come forward and to be at the table. That is really how, in my opinion, an organization progresses, is allowing that opportunity for those voices to be heard and valuing those different opinions.
Thank you. Well said. Gentlemen, I'd open up that same question, but stated maybe a little bit differently. You know, not from the woman's perspective, of course, but from a leader's perspective within your community and organization. What role can you play to encourage more diversity and inclusion? And that is diversity of thought, race, religion, and/or, you know, our LGBTQ colleagues. Either of you, if you don't mind responding. Whoever thinks they might want to offer something up.
Happy to start and then he can finish. But you know, in our community, inclusion and diversity, you know, have for a long time been a really core value, and that's reflected equally in our employee population and throughout our organization. And starting at our board level, you know, we frequently have conversations about, you know, making sure that we're continuing to promote and reflect those core values, and we try to be very intentional about reinforcing and encouraging those, and seeking out positions and participation from members of our community that might be considered to be in a minority position within the community. One of the couple of things that we've done in our organization that I think are worth mentioning is that a couple years back we started creating employee-led resource groups. The first of which was a diversity inclusion committee that focused on LGBTQ, and we have a second one starting up right now for Hispanic and Latinic employees. And these are committees that have broad representation from different areas throughout the organization and provides support for and guidance to our organization to make sure that we're properly including and you know, those potentially more diverse or minority groups. Our board also, you know, of course, tries to reinforce this. They'll be coming out next year with a board statement for the organization supporting diversity and inclusion. And the last thing I guess I would mention is one way we needed a measure of how poorly or well we are doing and make sure that we're measuring that we're always making progress. And so we adopted a health equity index scoring tool to help assess our organization. And the first year we measured ourselves, we only achieved about 60%. But it pointed out the areas where we had opportunities for improvement. The second year that we scored ourselves, we were at 90% and now have one of the highest scores in the state of Colorado. So I think that's a great tool to create awareness and make sure that we're on a path that really achieves the goal of inclusion and diversity.
I love that, and that score. That's fantastic. Rick, any to add?
Yeah, absolutely. We, you know, we're blessed to be in an area where we have strong tribal nations with the Utes and so forth, and yeah, we interact and try to figure out, you know, it's not just the kind of the healing part, but it's kind of how you heal, and so we kind of learned a lot about you know, what spiritual motives are also involved in the healing process of our patients. And a lot of that has come from some of the folks that work here. You know, we see a tremendous amount of you know, diversity and inclusion and positions of leadership here in you know, in the C-suite as well as the director and manager levels and so forth. And we have pretty good roundtables about you know, what can we do with you know, with various diverse population segments and so forth, and how can we make things you know, comfortable or better than comfortable for our patients and our employees and our community. So we will go out, we will meet, and we try to be involved locally, not just basically go up and show up for 15 minutes, shake some hands and leave, but basically, you know, to go in and get some things done. We felt very blessed when the U Tribe asked us to come out and put together a team and do some COVID testing, and we were able to test about 1,230 of the tribal members, and that was phenomenal. Great collaboration between both. You know, with our LGBTQ community, you know, we do have a significant population of our employees here that are part of that community. So we try to have a better understanding and better appreciation and recognize, you know, some of the differences that make us operate better in the full spectrum of things, rather than just looking at it from a potential view or something along those lines. So the other thing I can say is that when we promote people from within, we also try to take advantages of CHA and WHA for, okay, congratulations, now you're a leader. How can you develop and how can you bring some of your experiences to the table in your department and make the organization better as a whole? So we've got a significant portion of our folks from all walks of life that are involved in some of these leadership training courses, because some of us, basically, it's like, here you go, congratulations, you're a director. Okay, now what do I do? The chances are you're a great director, because you may not have the managerial expertise, but you got phenomenal leadership qualities, and it's an emphasis on us to go ahead and develop those, and not just say, well, they were a great clinician, but, and I'm talking everybody. So that's one of the things. We got to invest in our people and just make it happen, regardless of who they are.
I love that. And I love that each one of you, your approach is very unique, right? Given the communities that you all work within. And I think, that's where change begins to happen, one by one person at a time. And so I appreciate all of those perspectives. We've got about 9 minutes on the calendar here. I know we started a bit late. I'm going to end with one question, and I will ask the same question of each of you, because it's fairly broad. And then we may or may, we should be able to get at least one or two questions at the end. And this really is about, kind of what's next, right? So 2021 here. And, everyone keeps talking about 2021. Nothing magical is going to happen on 12/31/2020. There's not a vaccine that's going to pop up. So this, it's just very interesting time we're living in. But nonetheless, the next 90 days, which will bring us into January, we're going to have a lot coming at us, and a lot is going to come over the foreseeable future. So, we may or may not have a new administration. Supreme Court is supposed to hear arguments on the ACA and whether to uphold or dismantle that. That's going to have a direct and potentially drastic impact on whatever public option Colorado decides to roll out. The timing of the COVID vaccine is going to have a direct and potentially drastic impact on our economy. That's going to change our payer mix and have a lot of downstream impact there. Price transparency is going to go into effect 1/1/2021. And so I ask each of you, what are your 2021 strategies, and, what are the 2 or 3 things that you're thinking about that we should be thinking about? And I'll throw that out there, and whoever wants to go first, whoever's got something at the top of mind, they want to go first.
I can go. I really think, as I mentioned earlier, I think our delivery of healthcare is going to change, and it's going to be dictated by our patients, who are brilliant consumers. And I think that we in healthcare need to recognize that shift to consumerism. I think that price transparency, while there's some benefits and there's some significant cost to transitioning to that, it really is on a more global basis staging us for that consumerism. But I think it goes well beyond just price transparency. It's the way we deliver care. It's the ease of access. And it is the efficiency in which we can provide our patients information. And I really think that is what is going to mark success for independent hospitals. How quickly will we be able to adapt to those consumer needs and demands and expectations will determine our success.
Great, thank you, Yvonne. Rick or Bill, who would like to go next?
Go, Rick.
Yeah, no, that's fine. I try to stay muted. So, but yeah, well, basically we're in the 10th level of Jumanji, right? So, so either January will bring either about the end of the Jumanji game or bring us into the 3rd level of Jumanji. We haven't figured it out yet. Just kind of looking at where we are. It's again, who'd have thought we'd have been this far into telehealth, right? We didn't really have a telehealth program here, so congratulations. Now we're trying to figure out a good partner to kind of provide it on a better scale rather than just potentially an iPhone and a FaceTime, or I'm sorry, or a Galaxy. Sorry, I want to be inclusive. So whatever your mode is, whether it's Apple or another type of product. The other thing is like you know, you figured out how to how to kind of prepare for potential impacts. I mean, a lot of us have been in healthcare for a long time, and we always prep through the drills for pandemics and things like that. And now none of us ever thought that we'd probably live through it, or have to see it in our time before we retired. So, just kind of going into 2021, like Yvonne said, the delivery is going to be a bit different. The patients are going to be a bit different. I mean, our hope is that one of the things that I don't think is talked about is basically people that may be deferring care that may have adverse impacts on their health down the road. For instance, getting your screenings, taking care of your maintenance exams and things like that, to where if you do have something as awful as cancer, that you can head it off early. So those are potential impacts that I'd like to see addressed. Again, when we took a look at this, it was pretty much don't watch out from going to the hospital, to where I would like to see us better as a healthcare community. Go ahead and say, okay, we have COVID, we have something else is coming, we have this or that. Ever, please do not neglect your maintenance checks, especially, like, I think Yvonne's in her 20s, Bill and I aren't. So, and Yvonne, as you get to mine at Bill's age, you're going to have to, do some of these kind of exams. So please, everybody, take care of themselves. Get out. The greatest thing about working from home is, if you're on a stressful call, people can get out and they can walk around, and you can kind of, you get a better appreciation of little things. So, improving that aspect on our workers. Plus, we also saw that we also need to kind of ramp up for either addiction or mental health, and that's something that we're working to add here within the next couple of years to kind of improve that. Because again, it's when everything was shut down and everybody was trying to prep and everybody was trying to be safe, it also took a big toll on people's mental. It played games with everybody's minds, or so forth, in their outlook. So our hope is that we can go ahead and process this and kind of look on how to handle it. And this 2020 has been an incredibly adverse year, to where hopefully we know how to realize and kind of reset and go, okay, COVID was bad, we shut the economy down, we had to protect ourselves, we had to do these things, to where you appreciate where the big things are, and you don't always obsess maybe about a couple of little setbacks and things like that, because the COVID piece kind of reset my perspective into kind of thinking about how I react or how I kind of treat certain situations. So,
Great.
I mean, that's what I hope for 2021.
Thank you. Great messages. Bill?
I'll be relatively brief because I know we're running out of time, but I think COVID certainly exemplified the fact that the degree and frequency of change just seems to be accelerating over time. And I think that's likely to continue in ways we probably don't even foresee at this point. So in the midst of all that, at least for our organization, I think the thing we have to try hard to do is stick to the knitting and make sure we're focusing on improving the total value of healthcare for our community. So that'll be improving the experience, the patient-facing technologies and the transparency, the things that consumers expect and deserve. But it'll also really be making sure we continue to focus on the journey of improving quality and reducing cost. So that'll be core for us. Those are core elements of our strategic plan. Obviously, focusing on building on the success of our new partnership with Optum will be a priority, and so I think those are probably for us the big things that we'll be focusing on next year.
Fantastic. Jessica, do we have any questions at all for the panel?
We do. We have a question from Lionel Montoya, the CFO at Steele Memorial. His question is, how are you dealing with clinical staffing issues? This determines our capacities over anything else.
Anybody want to take that?
I would say from a clinical capacity standpoint, we've had to be nimble and kind of shift, and potentially we've had case managers who are keep up with their nursing licenses and things like that. you know, and they still kept up with their clinical skills to where we have, we've kind of redeployed them back into the field, into providing care. Either one is an ICU trained nurse, the other is just a med surg, or so, you know, redeploying them into the ED or ICU to kind of potentially look at explosions. We've also locked down a few people. One of the things that was kind of interesting is we did see some turnover, but our turnover was reduced. And then we saw a lot of applications from some healthcare staffing, you know, with respect to lab, pharmacy, and nursing. We saw some applications increase, and some strong quality candidates. So we were able to lock those people down. The other piece is, again, when we shut down surgery, we kind of redeployed some of those skilled nurses into maybe an ED type setting. Potentially, we have a level 1 trauma here, so we tried to. People kind of left their comfort zones, and that's kind of how we manage things. Probably our biggest issue was EVS, in retaining our EVS team. So we did look from a salary survey, and we were competing, but also some of the hotels in our area were kind of shutting down. So we did see some EVS people just kind of transfer in here, and you know, we kind of read them. Basically, it's like, okay, here's how we're going to prep everybody. Here's how we're going to deal with PPE and so forth. Kind of go from there. Here's how we're going to protect you while we're taking care of our community and our patients. So those were a couple of things that we did here at Southwest.
Fantastic. I know we're over, but we have one more question, and it's from Jonathan Wick. So Bill, I'm going to let you answer it, because Jonathan always wants to outscoop you and catch you. So his question is, where do you think telehealth will go in terms of sustaining as a channel for care, and will we achieve payment parity?
I wish I knew the answer to that. I think I'm clear at this point. You know, certainly during the peak of the COVID uncertainty, most of us saw, you know, incredibly high rates of televideo visits. We were at, you know, 70% of our clinic visits were televideo in April. Since that time, I think most of us have also seen those rates drop off quite a bit. I think in August and September, we're more like 15%. And as I've listened to some of my colleagues around the country, you know, I've heard experiences where it's almost all back to in-person. So I hope that's not the case. I guess my hope is that, you know, now that we've built the skill set, I'm hopeful that it takes a more meaningful role in providing future healthcare. It certainly seems like it should be, you know, more convenient. It's certainly equally as effective in many cases. And then I think a lot's going to depend on whether the commercial payers continue, how they can pay it. You know, unfortunately, it's going to come down to that. I think the jury's still out on whether, you know, whether they will continue to pay at a regular visit, you know, level. So I sure hope it sticks.
Fantastic. Well, I want to thank you all. That was fantastic. I thought that was a great conversation. We could have spent, you know, a couple more hours you all know I had several questions I didn't even get to. So I appreciate your time this morning. Thank you, and thank you to the members. Pilar or Jessica, I don't know, how do you want to wrap this up, or do we?
Yeah, I just wanted to say thank you so much, Tammy, Yvonne, Bill, Rick, for your time today. We really appreciate it. And while we have all of you here, we did just want to mention and remind those of you who are HFMA members or who are considering becoming HFMA members, that certification is now included in your all-inclusive membership. So if you've considered getting certified in the past and perhaps cost was a hindrance, it is included in your membership now at no additional cost. The tests are completed online on your own time and at your own pace. So if you're looking to get certified and stand out in your field, reach out to the chapter for more information about that. And that concludes our first session of the HFMA Virtual Fall Conference. We want to thank you all again for your patience with some of our technical difficulties today. We hope to have those smoothed out along the way. And we look forward to seeing most of you this afternoon for our CARES Act accounting. Have a great day, everyone.
Thank you. Have a good
Thank
day.
you, guys.
Thank you.
Bye, everybody. Thank you. Thank you to our wonderful panelists.